Thank you, Liz, and hello. I'm gonna say hello, friends, to kind of get us kicked off here, and everybody. As you can see, you've got me and Dr. Kazan and Holmstrom listed here on the slide, but it's really a team approach, and it's been several of us working on different aspects of FMD vaccine and vaccine planning. And this is part of the VS training and exercise program. And as we go through the day, just, you got any questions, drop them in the chat, or we can discuss them at the end. All right. So today we're going to focus on some of the key concepts of a draft herd vaccine management plan. This will include the purpose of the plan, responsibilities of the producers, state and federal government, movement of vaccinates, tracking, reporting of vaccinates, and also new additions or deaths in the herd. As with any response plan and response activities, things may change during an outbreak. And so I will probably say that numerous times as we go through here. So just keep that in mind. In the beginning, when we started this activity, we kind of asked ourselves, what's the purpose and why do we need a vaccine management plan at a herd level? And well, the main purpose there is to make sure that both the producer and the state and federal government understand what our responsibilities are when we initiate a vaccine campaign. We want to make sure that I'm gonna pause for a second. So this presentation, this discussion is going to focus on the draft plan. Y'all may notice that the draft plan looks similar to some of the ASF plans because when we were putting it together, we tried to make it as similar as possible. Makes it a little bit easier for the folks completing the plan, as well as, it makes it easier when we update things. Where we can, we're going to discuss settled policy. We'll also try to identify some areas where policy needs to be developed or where we're going to try to remain a little bit flexible on it. There are a couple of things this will not address. We're not going to talk about vaccine prioritization, vaccine shipment, vaccine storage, other logistical activities surrounding vaccine. Those are all important and they're being addressed in other VS in-depth exercises, webinars, and as we go through things and learn more information, we'll update those. Feel free to put the questions in the chat if you have some, and if we can address them at the end, we will, but that's not what we're focusing on today. So let's start with our responsibilities from a state and federal government. And I'll go ahead and tell you, I will probably use we interchangeably throughout this discussion. And that's mainly because it will be a state and federal partnership when we initiate a vaccine plan. And so we want to make sure that we understand that we're going to provide the initial vaccine for all susceptible animals on our premises. This will, of course, depend on how much vaccine is available, the type of response strategy that we're utilizing, and subsequent doses of vaccine may be the responsibility of the producer or the state, federal government. It just depends on where we're at in the outbreak. The state, federal government will also provide a point of contact for the producer for any questions and for reporting. And it's important to make sure that the producer understands that point of contact is there and that we're going to make sure they have someone, because they're going to have a lot of questions. And I'm sure initially there'll be a lot of concern about potential vaccine and vaccination. And we want to make them feel comfortable, because at the end of the day, the reason that we're doing the vaccine is to be able to return to FMD freedom without vaccine. And so we always want to go back to that in that discussion. We're gonna monitor the movement of vaccinates onto and off the premises. This could be with a permitting process or a process so that we are tracking those vaccinates throughout their production life. And we want to make sure that those vaccinates have a permanent identification. And we'll discuss permanent identification toward the end and some of the options that we have available. And so right now I'm going to kind of try to talk to y'all like you're a producer. Because ultimately that's who we're going to be sitting across the table with, discussing vaccinating their animals. And so we want to make sure that they understand that they're agreeing to vaccinate their animals. They're agreeing to allow subsequent vaccine of their animals. They're agreed that, you know, we'll set the timelines for when we'll provide the first vaccine and subsequent vaccines. And so, and we'll discuss some of that as we go forward on the vaccine timeline. We also want to make sure that we get a census from the producer. That census allows us to prioritize the number and doses of vaccines, allows us to identify if there are certain equipments, such as, you know, chutes, alleyways, whatnot. It allows us to plan for when we would vaccinate those animals. And we want to make sure they understand that, you know, by vaccinating their animals, they're going to have a little bit of a movement restrictions. They're not going to be able to just move vaccinates onto and off the prim whenever they want to. They're going to need to make sure that they work with us so that we know where those vaccinates go. Because it comes back to, and I'll say it again, you know, we want to return to disease freedom without vaccine. We also want to make sure they understand that, you know, they're agreeing to some disease monitoring, and all. So we're going to ask a producer that if they elect to, if calves are born, that they talk to the point of contact and make sure that they let us know. That it helps with getting additional vaccine for those susceptible animals. That includes if they add animals. If we're allowing animals to move onto that herd, that they are vaccinated prior to arrival or once they arrive on site. We want to make sure we get an accurate census of any deaths. This there again helps us track those vaccinates. The timeline for that reporting will kind of vary depending on where we're at in the outbreak. Initially, it may be, you know, a weekly, monthly deal. If the outbreak progresses, it might be, you know, at a set time, every 6 months or so. It'll just depend. But we want that point of contact, working with that producer to make sure that we are getting those animals vaccinated and that we're able to track them. So our plan structure here, you know, kind of like what we've discussed, we're going to need some premises information. Initially, that animal census, and you know, those primary responsibilities. We'll discuss some enhanced biosecurity that the producer will need to take on, those movement restrictions, as well as you know, the overall vaccine procedure, how we do that, and how we get the vaccine in the animals. So I'm going to pause for a second and let y'all glance over. This is the actual draft plan. You can see it says exercise, exercise, exercise up at the top. So I'm gonna pause and let us glance at that for just a second. So once we've identified an infected prim and we've created our control zones, we've identified herds within a vaccine zone or compartment that need to be vaccinated. We want to find out if that Prim has a premises ID, and if not, we'll work with them to get one. We want to make sure we understand if it's a commercial or non-commercial herd. What type of network? Are they integrated or are they independent? And we want to identify the premise owner as a single point of contact so that we can, reach out to them with those additional census questions and whatnot. Now, in some cases, you may have a prim owner have multiple animal owners, similar to our feedlot situation where, they're just a hotel for cows is what I've been told. In which case, what you want there is you want to make sure that if we have to booster vaccine, we've got that one point of contact, but that individual animal owner has to agree to vaccinate that animal. So that's kind of what we're capturing here. So on this page, you can kind of see that we're identifying, this is our census. So we're just wanting to know roughly how many animals you've got and what's the breakdown. That's important because beef cattle will get one dose and one amount of vaccine, whereas swine will get a different one. We also want to kind of try to identify here what is our identification, or at least the initial identification of those animals. Or do they have RFID? So if it's dairy and they have RFIDs, then we have that listed. If it's beef cattle and they have nothing, then that helps us identify if we need to procure the different RFIDs or tags. And at the bottom, I'll note that it says, if they refuse vaccine. That's interesting to note that, hey, if they are refusing vaccine, then there will be limitations on what they can do and everything. So we want to identify if that occurs. I'm gonna give us a second to read through this one because it's a little bit on the wordy side. So this point of the plan is one of the areas we try to build in a little bit of flexibility under primary responsibilities. Initially, it probably will be a state or federal person vaccinating the animals, or at least overseeing the vaccination. Depending on resources and the stage of the outbreak, it may be that the prim owner, staff, or a contract crew or something vaccinates the animals, similar, they're again in a feedlot. So we attempted to make sure we baked in a little bit of that flexibility here, along with the identification. Now, the requirements will be that they will be identified and that we will have a list of those and how they're identified, which would be added to the end of the plan. We also want to take and focus on that they will have to have an enhanced biosecurity, that they need to have a written operation specific plan prior to us implementing our vaccine campaign. So here, you'll note at the top, well, we'll give just a second here. The first section kind of focuses on an individual herd, individual premises. We like to know if they have a secure food supply plan. Note that's not a requirement at this time, but it is something that is important because we want to make sure prior to vaccinating that we've identified any risk factors, because you don't want to take and vaccinate a herd and it end up already being subclinical or be positive shortly thereafter. That's important because at the initial stage we got limited vaccine and limited resources. So we want to make sure we put our best foot forward there. The next section there, you've got movement restrictions. That goes into the basically you're quarantined. You're not able to move your animals unless you make that request. And so that just focuses on allowing producers to understand that's one of the requirements. The initial part of this one is going over the vaccine procedures and how we would administer vaccine, where it would be given, and what type of identification and documentation is required. And the important part here under the oversight and compliance is that your producer will have to sign off on the plan, as well as a BS and state incident commander. That way everybody is there again under the same understanding of what's going on. So we'll kind of take a step back and look at some of the different components of the plan now. You've got vaccine identification. And initially, we're probably going to have to be flexible on how we identify animals. This could be due to, the number of tags available, the priority of speed of vaccination, such as a feedlot can probably get them vaccinated quicker than, and by tagging them, we're actually slowing things down initially. So it may be that they vaccinate them and then they come back and put in an ID. Obviously, if they've got the RFID in there already, then we're going to record the tags. And so a lot of it depends on the production system that is being vaccinated. But there again, the main thing is that we're able to track and report which animals has been vaccinated and throughout their lifespan. That helps us determine our disease status. And there again, with the producer, we always want to remind them that, they're doing this to protect their own herd, but they're also doing it to help us get back to that FMD free without vaccine trade status. So all vaccines require a permanent method of identification and a permit for movement. This, there again, helps us keep track of the animals, keep track of their disposition, and allows us the ability to report to our trade partners their final disposition. A producer will have to report a census of all vaccinates and non-vaccinates to that point of contact. And here's some of our identification options. Currently, we have pink metal tags. Those are what we are currently planning on using. As more RFID tags get put in ears, we will potentially move over to where we're recording those RFID tags as vaccinates in the database so that we can track them. Other options, that we could utilize would be a brand or a tattoo. We'd need to have some approval for that, so that's not current policy. And then there's always the potential for animals such as swine or in some feedlots to potentially move as a lot or a pen. There again, the number one thing with identification is that we are focusing on tracking those animals throughout their lifespan. And so some of the other flexible issues and requirements we've got is that enhanced biosecurity plan. We're looking for it there again because we want to make sure that we are stopping or slowing the spread of FMD. And vaccine is just one of the tools that we'll be utilizing. Enhanced biosecurity for all premises, but especially those that are vaccinated is important. vaccine would not be, so that vaccine is not instead of biosecurity, it is in addition to biosecurity. And so those requirements need to be outlined in that herd plan, as well as testing. So our vaccine procedures that we'll discuss with the producer is, and most of them understand, we're going to follow BQA principles. And so the vaccine will be put in cattle in the neck. It's a 2 ml dose, and then it's boosted in 6 months. For pigs, it's PQA, and it's, boosted in 10 to 14 days for sows and boars. Feeder pigs, we don't anticipate to live long enough to get the booster because of their production system. The state and federal government provide oversight of the vaccine administration, and that means that we're making sure who's vaccinated, when they're vaccinated, when they're boosted. We will provide that point of contact for a producer to answer those questions, receive reports, to some extent, review with the producer, make sure that any questions they've got we're able to answer. We'll check in with their producer and the herd veterinarian if they have one, making sure that we're tracking those vaccinates and we're covering any issues or questions. Liz, I told you to be quick. So
that's okay.
Any
Tyler.
questions?
We do. We have a couple questions. There was one question came in, said, sorry if I missed it, but is there any room for someone to refuse vaccination?
Yes, there is. There's in the plan, there's a section there or a line where it says if the owner refuses vaccine. Obviously, if someone does refuse vaccine, it has its pluses and minuses. I mean, one of them being that they're going to limit, their movement and probably be even a little bit more stringent on what they can and can't do, what they can't bring on and take off. But yes.
The next question is anyone talking about requiring RFID for these vaccinates? We discussed using the time between vaccine request and receipt to get the animal census info and have on-farm personnel get tags in the animals prior to vaccine delivery, so we don't slow down vaccine deployment with ID requirements. That would depend on the availability of tags.
That was a long one, Liz. So I'm gonna make an attempt, and I'll ask him to put back in the chat because I can't see it if I don't address it. But the short answer is yes. The longer answer is it depends. Because and this is Tyler, so I'll just tell you, I can envision take a feedlot. Reports are that for them to put a tag in at the time of vaccine, it would almost double the amount of time it takes to vaccinate the herd. And so if we feel relatively confident that nothing is moving onto and off, then I can envision a scenario where everything would get vaccinated, and then at a later date, when tags were available, or when we just have time, then coming back and applying that RFID tag. Does that answer the question?
So, and also I want to remind everybody, if you want to, you can unmute yourself and ask a question. So Lisa, did that answer your question? Okay, well, we'll just go on to the next question then. Is there a withholding time for vaccinated animals?
Yes, excellent question. Currently, the withholding time is 21 days. prior to slaughter. Now, you have that where it's 21 days. After 21 days, you may have a potential trim issue up to 60 days. And so if it goes to slaughter between, we'll say 21 and 60 days, they may have to trim that injection site lesion that's caused due to the adjuvant, the mineral oil.
Okay, the next question, what of lost tags, animals, or dual ID being required? I'm not sure if that's the correct question. If you want to put that question in again, or unmute yourself and ask it verbally. Go ahead, Billy McAlpin, you can unmute. And
what is the drawback on the dairy cattle milk? If you're in a milking and you have to vaccinate, what do you do with the milk?
That is an excellent question. And I will tell you that I don't know 100%. I mean, I know we know the answer, and I'm, in the back of my head, I'm thinking that you can continue on milking because it's just like a regular vaccine, BBD or one of those. But that's one thing that we probably need to put down, Liz, that we have an addendum into this plan identifying exactly if there's a milk withdrawal. Billy, I'll tell you that right now, I don't believe there is, but I don't want to lie to you.
Hey, Tyler, it's Lindsay. I'll just also add, there's no public health issue with milk from vaccinated cattle. There might be requirements, there's no requirements now to trace milk from vaccinated cattle, unless that for some reason comes up as an international trade requirement. But obviously, it'll be a different situation if we're talking about disposition of milk from infected premises, but no public health risk as far as from milk if those dairy cattle receive FMD vaccine.
Thanks, Lindsay.
okay, let's see. The next question is, if in an infected zone, what is the likelihood that those cattle that can get vaccinated will be destroyed for safety and risk concerns?
Read that one more time.
If in an infected zone, what is the likelihood that those cattle that get vaccinated will be destroyed for safety and risk concerns?
For safety concerns, I would say the likelihood is zero because the vaccine is safe. The risk is everything is risk-based. And so if, we're vaccinating animals, ideally to go to slaughter, because both we don't want to waste the protein, and that's kind of where that is at. But if we're able to suppress the outbreak quick enough and get to disease freedom quick enough, then could they be, depopulated at that point in time? Potentially. But right now, I would tell you that if we vaccinate them, it's vaccine to go to slaughter. But there's a lot of options, I guess.
Yeah, and I'll just add to that, Tyler, too. If you're talking about an infected zone, right? So that's around where within 3 kilometers, that there is a positive or a non-negative premises. So you have risk there, right, of a vaccinated, in this situation, cattle becoming infected. So that's where that surveillance piece will be really important, using a DIVA, capability diagnostic. As far as the risk there is, a vaccinated cattle that becomes infected has an increased likelihood of then becoming a carrier. And so that surveillance monitoring is going to be really important, but that's also a consideration for states. Is where are you going to place that vaccine zone? And obviously this vaccine management plan, as Tyler mentioned, it's very similar, modeled after our flock plans or our herd plans, which are for infected premises. But it's really tailored to, and our response plans are tailored to eradication, right? The focus is eradication and containment, and that's going to be a priority, especially in the early days of using limited vaccine. So, determining, you're going to place that start vaccinating that, that close to an infected premises is going to be outside the control area, which for FMD, it's 10 kilometers. So those are all discussions, to be had, but, from a risk standpoint, if you're, vaccinating close to where a known infected premises is, that surveillance and biosecurity is obviously going to be really critical, because we don't want, vaccinated animals to still be infected, which is still a possibility, right? So the vaccine doesn't protect them from being infected.
Okay. The next question is, I'm not sure if this might have been already talked about, but separating tagging from vaccinating may cause failure to ensure that all vaccinates are ID'd. What are the consequences of unvaccinated animals being tagged or vaccinated animals being untagged?
Okay, well, before we answer that question, I'll say this. I think, we all have to go into it with a little bit of trust, both with our herd plan and who we vaccinate. And they have to trust us and we have to trust them, because at the end of the day, if folks are going to try to get around it by removing tags or tagging things that are not vaccinated, then that's part of that plan, so that we have a little bit of teeth there to make sure they understand that. So that's that part. As far as the vaccinates getting out without a tag, I would hope that's covered under our permitting, and that anything on that prem can't move without a permit or without some process. And I say permit, but that's maybe a term of art, so don't hold me to that exact term, but they're gonna have to be moved, and we're gonna have to allow that movement. And so any vaccinate should be identified and moved. Now, to answer the question, I mean, it really comes down to a trade issue, in that if a vaccinate that we don't know about gets out and is identified down the production chain somehow, then it will cause us some trade issues and potentially, make us have to go through a lot more labor and testing. Lindsay, I'll defer to you a little bit on that one too. So.
No, I agree with what you said. What you said there, Tyler.
Okay. The next
And
question
I'm
is,
just sorry, Liz, I'm gonna interrupt you, but yeah, it kind of goes back to what Tyler said as far as the importance of that census, and then having that contact person, be available, similar to how we do a case manager, for those familiar with how we do outbreak response, but having that liaison, that contact that producer can ask questions with, keep up with records, and kind of having what Tyler mentioned, that constant relationship and communication, and making sure, we're keeping up with, the animals on site, if there've been any new additions, births, deaths, that sort of thing. But really managing within that plan, that expectation of what animals on the site you're actually going to be vaccinating, and getting that good census ahead of time, as well as during, that vaccine campaign being implemented. Sorry, Liz, I interrupted you.
that's okay. That's all right. If we're done, we'll go ahead with the next question. Is in consideration to vaccinate the whole herd or a percentage of the animals?
Yes.
Thanks, Tyler. So I'll add to that. So, and I think we have other experts on the phone too that can speak up, but usually, yeah, at least 75–85% of the premises within a zone is what we would target as far as a vaccine campaign. So you really have to think about that, right? As far as the difference between, how dense your zone is, how large your zone is, because the other piece of that is speed. And so we've seen that with, other outbreaks. We've seen that with modeling that, speed is really important. Getting needle into animal is really important. And I think we would always, try to vaccinate 100% of the animals identified, on a premises, at a premises level, but then looking at, how many prems within a zone you need to vaccinate to help in this case, again, it's containment, trying to stop the spread, would be at, trying to aim for at least that 75–85% target. And again, speed, so within 10–14 days is a number we've been advocating as far as, getting all the prims vaccinated within that time period as is possible.
And Liz, that kind of does go back to our census, which I hate to keep going back to that, but that's the important part of when we sit down and across the table from that producer and we know how many head they think they have, and that way we can allocate the vaccine accordingly.
Right.
Okay, we do have a couple more questions. This might be awful specific, but what are the minimal data points needed to collect upon vaccination, such as official ID, site of neck vaccinated, date of birth, male, female, etc. For data capture, minimization is better.
Let me take that, Tyler.
Yeah, because
Okay, so we do have modules developed already in EMERS, and for awareness, EMERS is in the process and almost done with the modernization and moving over to Power Apps. So that's going to give us a lot more flexibility as far as being able to do some mobile type data collection versus doing paper-based and then having to enter it into EMERS. But we have modules developed and we have training developed and a lot of really good resources within EMERS now, where they have really thought through what that vaccine module needs to look like within EMERS, so that you can monitor both at the premises level as well as the individual animal level, to include when is it that you might need to boost your animals. And then we're still working in kind of what you're alluding to, Sean, as far as what are those key data elements that need to be collected for any individual animal that's vaccinated, and trying to keep that minimized, because we know the data entry, we don't want that to be something that delays or is burdensome for a vaccine campaign, but making sure that we collect kind of those key data elements. So they're mostly in EMERS now. I don't want to misspeak and say stuff that's not in there, but I know we are also actively discussing that as far as making sure what we have within EMERS is what we want, make sure we're not missing anything, as well as keeping that as minimal as possible, but identifying those key critical data elements to collect for any vaccine campaign.
Okay.
Excellent, thank you.
Yep, thanks, Sean.
Will vaccinated animals that get to move to slaughter come with paperwork identifying them?
that's currently the goal. So they would move, and how that movement is, we don't have that quite outlined just yet. And so I hate to say whether it's permanent or not, but you take the old VS, I think Bruce likes to use the old VS 127 as an example, that we would have them move to a slaughter establishment with some sort of paper record, so that the slaughter establishment understands these are vaccinates, mainly because of the potentially that goes to slaughter between 21 and 60 days. If they've got that lesion that needs to be trimmed, we want them to know be told as many ways as they can that those potentially will need to have the lesion trimmed. That also works with FSIS, so that they understand that that's a vaccine reaction that we know about versus an unknown lesion that they then have to test.
Yeah, thanks, Tyler. And I think there is MOUs, right, with FSIS, as far as making sure that they know, and they will want to know, right, like where that animal is vaccinated, so that lesion can be identified as from the vaccine itself. But yeah, we do see this process, as Tyler mentioned, working similar to a permitted type movement, where you have the SAHO being able to approve that movement. You have paperwork, diagnostic testing if it's needed to go along with that, and so all that can be easily seen, as well as communicated through EMERS or a state permitting system for that movement to be allowed to occur.
Okay, Joanna Davis put in a great link for the APHIS FMD public webpage. If you want to copy that out of the chat. Good information. Thanks, Joanna. And the last question I have in the chat is any comments you can add on wildlife species that may be in the area? Any consideration?
Is that as far as vaccinating wildlife? Or just concerns about disease risk?
Hey, Lindsay, Vivian O'Donnell here. I added that question. Yes, if you can add, if it's anything in consideration for vaccination or risk, if you can expand in there would be great. Thank you.
Yeah, so currently in that link that Joanna posted does have two different documents, both a policy document on vaccine that kind of gives a high level information about prioritization, so the type of species and production types that likely would be prioritized for vaccination, again with the thought that we're in the eradication, trying to get to freedom, as Tyler mentioned. There's also a ready reference guide on that link too that talks about vaccine and species, but right now we wouldn't prioritize or don't plan to vaccinate any zoological species or wildlife species at this time. We know with FMD, I mean, obviously we have a lot of wildlife in the US, right? So white-tailed deer, feral swine are a concern. And a lot of outbreaks that have occurred, they haven't played a significant epi role as far as maintaining the disease beyond that local situation. So obviously if we're in, a state with a high dense, feral swine population or white-tailed deer, then we're going to assess that at the local level as far as that potential spillover and any surveillance that may be needed. Good thing with swine is that they can clear the virus, I think after 21 days, so they don't become carriers. So that's really good. That's different from a response that we would do for ASF or CSF, so African or classical swine fever, where they can play more of a role of maintaining that endemic type of situation. So it's very much going to be as far as the risk, looking at the local level, what those densities are, potential contacts. Obviously we'll advocate biosecurity from a standpoint of, if you have cattle out on pasture and you're right where, you have feral swine coming, in and out of those pastures, is there a way to move them in, corral them up or something like that to help with, try to prevent that crossover as much as possible. But it'll very much be a local response and evaluation as far as if any response is needed from a wildlife standpoint, but it won't be as immediate as we would do ASF or CSF, as far as if we do have a detection in a feral swine population, for instance. Obviously we're going to be responding, although it might take time to develop that based on the landscape, habitat, location, resources, etc.